So today we're going to teach Andrea how to do Moxibustion, acupuncture point called bladder 67, and this is because her baby's Breech. And the best time to do Moxibustion is around starting 34 weeks, between 34 and 36 weeks. And so I'm just going to show you, this is a Moxibustion stick. And so it looks like shaped like a cigar or like a large piece of coal. It's an herb aye or mugwort. And to light it, you're best to use a candle, and you just kind of hold it over the flame like so. And it'll take a minute or two to light. So while we're lighting it, I'll just give you an explanation that there's two forms of moxa, smoking moxa and smokeless moxa. And although you do see a bit of fumes right now just as we're lighting, this is the smokeless form. While as you're lighting it, you need to pick it off and blow. You want the whole thing glowing. So again, it will take a few minutes. A few safety issues. One is, do not touch yourself with this moxa stick. Hold it above acupuncture points. We're not doing direct moxa. It's best to do it in a ventilated room, so don't do it in a small room where the windows are closed. And also, just like fire hazard, don't, sitting in bed where there's lots of flammable sheets, you need to be very careful for fire reasons. So that's what it looks like as we start to light. And now I'm just going to switch over here and show you what it will look like when it really is lit. And as it burns, it will develop ash at the end of it. And so to get the heat, you do need to rub it off. So that's what it'll look like when it's nice and glowing. So another safety aspect of it is when you're done using it, you suffocate it. And we have special moxa holders here to keep it like this when it's lit, or if we want to suffocate it. We don't recommend that you put water over it to suffocate it, because it will kill the moxa stick after a couple of uses. And so what we recommend is you grab a mug, a coffee mug that you're not using, and fill it with some dirt from your garden, and then just fill it half to 3/4 way full of dirt. And when you're done using it, just stick it halfway between to suffocate it. So now we're going to do the Moxibustion demonstration on Andrea. And so the acupuncture point to locate bladder 67 is basically where the base of the nail and the most outside of the nail, where it intersects. That's the location. Now for an acupuncture needle, you want to be a little bit more accurate, but for Moxibustion, you're basically just sticking it or pointing it to the outside of the baby toe, which is where the point's located. And what some of the studies are suggesting, what people are doing to help turn the baby, again starting around 34 weeks if it's Breech, is to Moxibustion twice a day for 15 to 20 minutes at a time. And so what we suggest is you do 5 minutes on the outside, on one side, then switch over, and you do 5 minutes on the other side, so up to 10, and then come back for the last 10 minutes and do 5 on this side, and then again 5 on the other side. You usually want to create some more room for the baby, so she should be in a comfortable position where her belly and her breathing can expand nicely. And so this is for the partner to do, and for the mother to just relax and enjoy it. And she probably will feel some movement and kicking of the baby. Like right now we can see the baby moving over to her right a bit. So this just gets the baby active and helps the baby turn. And again, once you think the baby, or you know for sure the baby has turned, then you would stop the Moxibustion practice. You don't need to do it anymore. And what's recommended is to do it for 5 to 7 consecutive days, twice a day, for 15 to 20 minutes at a time. We recommend 20 minutes. And at the end of a week, take a few days off, or a full 5 days off. And if it still hasn't turned, go for another week of Moxibustion. It should feel comfortably warm. It shouldn't feel like you're being burnt. So if you can't feel it, we can get a lot closer. And if that feels too warm, you just pull it back. And again, you do it for 20 minutes, 5 minutes on one side, then 5 minutes, and you keep alternating until you do 20 minutes. And then later on that day, you do it again. If you find that your baby has turned and it's now in the head down position, then you don't need to continue doing the Moxibustion therapy.